Hi, welcome to the Unsecurity Podcast. We have conversations to give you insight and inspiration to elevate security efforts. We're your hosts. I'm Brad Nigh.
And I'm Megan Larkins. On this podcast, we feature experienced InfoSec peers as we dissect major issues within the industry. Here's Unsecurity. Hello, welcome back to another episode of Unsecurity Podcast. I'm Megan Larkins, and with me as usual is Brad Nigh.
Hello, Megan.
And we're joined this week by April Meyer, our senior consultant and subject matter expert on the healthcare industry.
Hello, Megan.
Well, welcome and thank you for joining us, April. So we've got a awesome conversation. We're going to talk to April about what she's seeing in the industry, how we kind of think members of the healthcare industry should be thinking about it in light of the continued delays, postpones to the new HIPAA security rule, and just have some good conversations about what it's like to work or think about information security in the industry. So thank you. And before we get started, we'll talk about a little bit of hobbies. I don't know, April, if you want to get us started or defer to Brad, but what you working on lately?
I'm just working on moving and getting my fiance's house ready to sell. So I've been doing all the painting.
Oh, wow.
A lot of fun. Not really.
I was going to say, do you enjoy it or not?
I do not. I am so over it, but we're close.
Nice.
Okay. Good luck with that. How about you, Brad?
Thank you.
My kids know how much I love like building models and stuff. And so my daughter got me a bookshelf book mall thing. You can see it kind of what it looks like. So to give you an idea, it is very tiny. So like.
Oh, wow. Yep. That looks like adequately detailed work for you.
Yes. There is a lot of, I've got so much stuff laying around because I just work on it in the office. It's just a nice, clean, easy workspace, but there's lots of pieces.
Yes. Nice.
What about you?
I haven't been dedicating my time to any single thing. I've been hopping from thing to thing a lot lately because, I've got a little model that I occasionally pick up and work on. I bought myself some cinder blocks so that I can build a more permanent shelf for the bonsais I inherited from my dad. And I've been still trying to bike here and there. And we just picked up the game Big Walk. Have you heard of that one, Brad?
No.
It's a community or like a game you play with other people. You can't play it by yourself.
That could be my antisocial tendencies. So
so maybe not. We started playing that as a family. It just came out on Tuesday, and we had a blast so far because it's called Big Walk or the Big Walk or something like that because they have put you in a world and you just go through, and the interesting dynamic is the voice and conversation is built into the gameplay. So there's no separate chat. It's just you're in the game, you're in the chat room with everybody. But instead of it being like a universal chat room, it's proximity chat. So if somebody's far away, you can't hear them. So if they wander across a mountain, they have to find their way back to you or vice versa. And they give you tools to do that, like walkie-talkies, flares, different meeting points, bumping into each other. It's fun. And then there's puzzles for you to solve. So like one example was we played, my husband and I and our two kids, and my husband and I went one direction. The kids went the other direction, of course, right? And we landed in a puzzle and we were trying to solve it, the two of us. And it was like a time-based puzzle. And we realized we couldn't finish it, just the two of us. We needed at least one more person to pass this like thing to get it to the end of the thing. And so then we're like, well, how do we get one of them over there? And so then I go find this light thing and I start flashing it like crazy. And eventually my daughter wanders over. We're like, okay, good. You're here. Now you can help us solve this puzzle. So we've only just started that, but that's not necessarily hobby, but definitely the fun thing of the week. So I'll go with that. But so we'll transition though to healthcare conversation. I don't know, April, if you have any particular place you want to start us at, maybe with what are you kind of seeing or hearing in the industry at the moment?
Yeah, well, as we know, healthcare continues to be one of the most targeted industries, right? And unfortunately, that's not going to change anytime soon. There's a lot of value in the bad actors targeting the healthcare industry. Just given the fact that organizations are responsible for incredibly sensitive information, they depend very highly on technology and operate in some of the most complex environments that you'll find in any industry. On top of that, they're dealing with staffing shortages, budget pressures, third-party dependencies, and increasingly sophisticated threat actors, as we have seen over the last several years. What I've particularly seen is that cybersecurity has really started to evolve from being primarily an IT issue into something much bigger than that. It's now become a business risk issue, an operational resilience issue, and in a lot of cases, a patient safety issue. When ransomware impacts the EHR, the imaging systems, pharmacy operations, or scheduling platforms, the consequences go far beyond technology. And that's one of the reasons that we're seeing increased attention from the regulators and why the proposed HIPAA security rule is generating so much discussion. You can look at incidents like the Change Healthcare incident, which disrupted healthcare operations across the country and affected providers, pharmacies, payers, as well as patients. Or incidents that have impacted healthcare technology and medical device manufacturers, such as the most recent big one was the Stryker attack, which just highlights how dependent our healthcare organizations have become on third-party technology. These events should remind us that cybersecurity isn't just about protecting the data, it's about maintaining access to care, supporting clinical operations, and ensuring patient safety above all.
Have you seen that mindset shift in the clients or other contacts that you're working with yet, or is it still kind of an uphill battle?
There is a mix. I would say I probably am pretty lucky with most of the clients that I work with. They really have adopted that mindset within their organizations. I do have a couple that struggle. And overall, I think, they're starting to come around, especially the more significant breaches that we see, such as Change Healthcare and Stryker. It really starts to open up leadership's eyes so that they view this as a business risk issue and not just an IT issue.
Yeah. But I can imagine that's got to be a huge shift for them. And then I can kind of only imagine the internal, I don't know if turmoil is the right word, but definitely thought shift and approach that shift and even back and forth that you could kind of see with ownership of those things going between IT and then the other managers and compliance officers or other. Now you've got to get, like you said, your patient safety people involved as well.
Mm-hmm. Yeah, there's a lot of moving parts to it, for sure.
Yeah. I think the big thing is the new proposed rule, right? The HIPAA security rule went into effect 20 some odd years ago, so slightly out of date. What are the biggest changes that you're seeing?
I think from a compliance perspective, what we're seeing is a shift away from the HIPAA security rule just being a compliance mandate and more of a security risk-focused mandate. For years, organizations approached HIPAA as more of a checklist exercise, check the box for compliance, right? The goal was to pass the assessment or satisfy the auditor or maybe complete the documentation. What regulators seem to be signaling with the proposed updates to the rule is that they're less interested in whether a policy exists and more interested in whether the organization actually understands and manages those risks.
I know industry-wide, I think HHS said the initial first year to be compliant, they were expecting $9 billion. And then years 2 through 5, about $6 billion a year to the healthcare industry. Mm-hmm. But when you look at the changes, it's things like require encryption, require multi-factor, annual or anti-malware, annual pen test, 6-month vuln scanning. I mean, it's really not anything we're not seeing in other, that hasn't been around in other regulated industries like finance, banking. The SEC is requiring that stuff. So I don't know. What do you think of why is there so much pushback other than, well, now we're going to have to do it? Or is that it?
That really is the challenge, right? Healthcare, because they have taken the approach of this is more of a compliance thing, and they haven't really had their hand held to the fire when it comes to not meeting those requirements. A lot of our organizations don't have the basics in place. If we look at the Change Healthcare breach, that was due to, compromised account and lack of multi-factor authentication in place. Some of the basics, the most fundamental things that we talk about and, educate our users and our clients on every single day are lacking in the healthcare industry.
I guess I can imagine that kind of, almost came to part based on how a lot of HIPAA guidelines were written, right? It was like, to the extent that's reasonable to your business, like if it's feasible, you can do it. And you can almost always make a case for that's too hard or that's too expensive. It's inconvenient. It's going to slow down or impact our ability to deliver care. And so therefore we think we have a reasonable excuse not to do it. But what they missed was that they're going to be impacted regardless, because those are the security things they need to do to become a more resilient organization.
Yeah. I think the big thing too is they get rid of addressable, right? It's now all things, everything is required.
Yes.
They were like, well, you chose not to address it on your own, so now we're making you.
Basically.
That's exactly it. You both are spot on there. There were so many loopholes, or there are so many loopholes in the current rule that it was left up to the organizational leadership to make that determination whether, we can do it. Well, we don't want to deal with the pushback and the blowback from the doctors and the medical staff, because it's going to slow down their ability to see patient after patient after patient.
Yeah.
And the reality is we've seen healthcare, hospitals, there's solutions out there that address that.
Mm-hmm.
The problem is you got to put the money in.
Best.
Yep. And we all know, healthcare is such a low profit margin anyway. It's going to be, I understand the pushback, but at the same time, it's like, going back to PCI. Why is there PCI? Because the credit cards went, oh crap, we don't want the government regulating us. We'll do it ourselves. Healthcare had that opportunity and didn't do it. And this is kind of the blowback or the fallout from that.
Yeah, absolutely. Absolutely.
They probably didn't have like the same financial motivation that the credit card companies did. They were like, oh yeah, fighting fraud is in our best interest. And healthcare didn't make that connection maybe as directly or soon enough to do it. And it does seem kind of unfortunate, because I know some of the rules or the things that I think we've looked at is now it's not even just that you have to do it. You're going to have to document evidence of pretty much everything, because when the auditor comes through, they're going to need you to prove it. And if you can't prove it, then you're going to be found.
Yeah. Well, that's a good segue is, if the OCR comes in to investigate, what are they going to be looking for? Like, what are organizations going to have to provide?
So I typically simplify this, or I have simplified this into 3 basic questions, right? First, did you identify the risk? That's what they're going to be asking. Did you identify that risk? Second, did you do something about that risk? And third, can you prove what you did about that risk that was identified?
So really not anything that we don't already say, like identify the risk, make a risk decision that is defensible, and have evidence that shows you took the actions you said you were going to take.
Absolutely. And we know most organizations, the biggest struggle for them is the remediation and documentation. Mm-hmm. 9 times out of 10, they may remediate it, but they don't document it, or it's not a clear path that they can prove to an auditor or regulating body.
So, so we said the rule got pushed back to now July of 27, although HHS could, OCR, whoever, could publish a final rule prior to that date. But, what should healthcare organizations be doing now, even with that rule being pushed a year, to prepare for it? Do you think there's going to be substantial changes, or is it just more, hey, we're going to give you a little more time to prepare?
I don't foresee a lot of substantial changes to the proposed rule. And just what I have, been seeing and hearing in the industry with some of the other regulators, based on the time frame and things that continue to get pushed back. I knew initially when they released the dates of March of 25, that comment period would be over, that we would see a delay. A change in administration typically slows things down, good or bad, right? It has absolutely nothing to do with the political party, but their initiatives and what's important on their agenda, right? So I knew we were going to see some type of a pushback. But as far as, where we are today, I know that OCR, HHS, with a lot of the things that have been put in place, they have some hard decisions to make. They need to really decide how heavy-handed they want to be, how involved do they want to be, because some of the recommendations, there's going to be a lot of effort needed on their part to conduct these audits, to really evaluate and validate. So I know that a lot of that is what has really caused things to slow down. But in light of that, regardless of whether the rule is final or not, I encourage all of my healthcare clients to really take a look at, evaluate where your environment is today compared to those proposed changes. Do we have multi-factor authentication in place across the board? Do we have network segmentation, especially around our EPHI? Encryption in transit and at rest? Are we conducting those vulnerability scans and those annual pen tests? What are the things that we have in place? What don't we have in place? Do a gap analysis and start working towards putting those security controls and processes and procedures in place, and practice that, so that when that final rule does become law, they're in a much better place. And even if some of the things shift or they're, reduced in the complexity to a certain degree, those healthcare organizations that start working on those things now and implementing those controls are in a much better place overall from a cybersecurity perspective, whether it becomes rule or not.
And just while you were talking, I was like, why do we need to do this? And there were 15 reported breaches that are under investigation in July. Roughly 4.5 million individuals affected. The biggest one was 3.8 million. A couple in the upper, hundreds of thousands. So yeah, that's why it's continuing. That's one every 2 days.
Yes.
It's enormous.
It's scary is what it is.
Yeah. And that's only the ones that affect at least 500 people. That's not including the quote small breaches.
Yep. Exactly.
With the clients and the people that you talk to, April, are there kind of common themes of where the organizations you have, like that they have gaps kind of due to the nature of their organizations? Like, are there specific areas that you're kind of seeing as gaps that you're recommending they start with? Or
yes, absolutely. When you look at our client base, we've got clients at all levels of maturity. But if I were to sit back and analyze, what are some of the more common themes, I think they've done a relatively decent job implementing MFA, but in certain cases, not across the board. Encryption, most of them are ensuring encryption at rest, but they're lacking the in-transit piece. The asset management is a huge one. I've got so many clients that are struggling to put together a comprehensive asset management inventory that covers, the hardware, the software, the IoT, the medical devices, all of it, because all of it comes into play. We can't protect what we don't know about. And so that's typically where I'm starting with clients is let's really evaluate this and make sure from an asset management perspective, we've got everything covered. Beyond that, making sure that they've got their network diagrams and data flow diagrams. Where does that EPHI live? Where does it transmit between systems and things like that, so that we can make sure we've got that visibility, we've got those practices in place, and those necessary security controls.
Have you had any specific approaches, especially going back to that asset management? Because there's so much, that's what I recall from working with just less than a handful of healthcare clients too, is there's so much, it's hard to get your mind around even trying to get that holistic of a asset list put together. Do you have any tips of how maybe listening organizations could potentially get started or get a little bit more on top of it?
Yeah, it definitely is a challenge, right? But it's not a challenge that we can't overcome. So the first areas that I tend to focus on is let's take a look at what we have currently today. Do we have any type of asset inventories out there that maybe IT is managing, or maybe a different department, shadow IT is managing? Let's pull all that information together. And then let's look at the tools that we have in the environment that can do some network discovery to identify, are we aware of everything? Let's cross-check that with procurement. They've got records of things that are purchased or leased, so they're going to know, at least from that perspective, what we should have. So starting there and just evaluating where those gaps are. When it comes to the medical devices, that becomes a little bit more of a challenge for a lot of folks. One of my clients has actually decided to kick off a committee to work on this, to establish that comprehensive inventory that includes those medical devices and IoT devices, so they can ensure that they're being patched and they're being scanned as appropriate, right? Because we have to be careful with a lot of the lab equipment and things like that.
Mm-hmm.
So. Yeah, because I imagine in most cases, IT is not managing or overseeing those medical devices, and that probably includes some other amount of random IoT, maybe that's not even medical specific too, huh?
Yes, absolutely.
Yeah.
And so I don't know, just randomly, because it's on the top of my head, it's DEF CON week, and one of the CTFs that we've typically participated in is Biohacking Village, where you hack and find vulnerabilities and find the stuff in medical devices. And just let me say, if I can get in and change dosing and rates on pumps, that's not a good thing.
Right.
Right. And that's what I think a lot of healthcare organizations don't realize, right? I hear oftentimes, well, we don't manage that. The vendor manages that. The vendor's responsible for that, which leads to another issue, right? Mm-hmm. We need those suppliers to be on board with the cybersecurity practices as well.
Right. I imagine the doctors reviewing what medical devices they're going to use, either it's the brand or the set or whatever, however they categorize it. They're probably not looking at security. They're looking at how it functions and how it's going to serve the patient, and the patient impact, direct patient impact, not, and can it be hacked and negatively impact either our organization or the patient themselves. Mm-hmm. Like you said, with dosing, that would be huge.
And that's where third-party vendor management comes into play, right? Making sure that we've got a process in place where when providers or anybody in the organization wants to bring something new in-house, that security is reviewing from a security perspective to give that approval. Yes, we can move forward, or no, there are conditions, or, at least allow the business to make an informed business risk-based decision on, do we accept that level of risk? And I've worked through that with a few clients.
offhand, just wondering, like, do we know if there's been any cases of a breach of a medical device and who is responsible for that? Like, has the hospital or the doctor themselves been held responsible for selecting that device, or has all responsibility gone to the vendor? Because that would be an interesting case to follow and see and demonstrate. No, your clinic, your hospital is responsible for not using appropriate vendor, rather than, oh no, well, the devices were by this company and only that company is held responsible. So the doctors can just be like, oh, well, we didn't know.
Yeah. So Medtronic got breached in April of this year. That was 3.8 million people. And so there's no mention of any of the doctors or anything. It's all Medtronic responsibility.
Right. I wonder where it comes into.
The problem that I've seen is, right, there's a known vulnerability, but the hospital has no ability to patch because the manufacturer doesn't update it. Right. So it really is that is the problem, is that healthcare is so dependent on manufacturers, and until they're, held accountable and have,
if they don't see any risk there.
Yeah. What's their incentive to patch it? And, that costs money and potential disruption, or, oh, well, it happened, we'll give you credit monitoring.
Right. I think back to, like, my sister-in-law, she did have one of those pumps, I forget what they're called, installed in her shoulder because she had to have some sort of shoulder surgery. So it managed pain. Yeah, I guess it was just called a pain pump, was what I knew it as. And it ended up, at least over time, tearing apart and ruining like the cartilage or tendons or something within her arm. And that became a big lawsuit that she had against. But my recollection is it wasn't the device that got blamed in that case. It was the clinic, the doctors that installed it. So I can only imagine there must have been some degree of blame passing of, like, okay, was it your device that wasn't well put together, well tested, and so therefore, or was it that you guys installed it wrong or in the wrong case?
Right.
So I imagine, yeah, the more you can know about that. So I'm just trying to think in cybersecurity perspective, it's got to go a little bit of both ways. Like, if Medtronic, as the example, did release a patch and you didn't install it, now it's your facility, your hospital, your clinic that took that's responsible because it was available. You needed to push this patch out, but you didn't. Versus, well, Medtronic's not releasing patches. They're not putting out solid, secure devices. I'm tangenting a little bit.
Well, and I think that the challenge there with that is you kind of hit the nail on the head, but with a lot of those medical devices, our healthcare facilities have absolutely no control over pushing a patch, right? They rely on the manufacturer to do that.
Okay.
And you take a look at some of the vulnerability scan results for some of our healthcare clients, and still, like, Windows XP is out there because those medical devices are running on and they can't support the upgrades. I know I've got a client actively working with a vendor right now, and they've been actively working with them for 2.5 years.
Oh my gosh.
To get it to a place where they can update the underlying operating system. And they had been previously notified earlier this year that it was now capable of supporting Windows 11, and they went ahead and they upgraded, and it broke everything. It broke everything. So they had to revert back, and they're still dealing with the fallout.
Yeah. Well, and I know we're coming up on time, but like the mitigation is network segmentation, right? I mean, you got to isolate those devices and only allow the ports and IPs that are required. I mean, that's your only option a lot of times. And that's hard work.
Right. I can see that's being a lot of overhead for your IT department to constantly be adjusting those network segments, those firewall rules, to make sure that just enough is allowed, or just exactly what the particular device. And I don't know how often, depending on the clinic size or the hospital size, how often they're bringing in new devices, having to set up how many different segments that allow communication only with the parts that they need. It's very intricate. And then we go back to they're usually understaffed and underfunded. And so how do you get to the point of like, well, the doctors say that this device needs to be able to talk to that, so I just have to allow everything. We don't have the time, the days to go back and forth testing and figuring out. And the admin guides don't usually help, right? They're like, yes, allow everything. We need admin rights to everything.
Right.
You're not supposed to have that. Yeah, big challenge. So I guess continued good luck to the healthcare industry as they try to do that. The regulations will help provide clarity on the things they need to do, but certainly not make the challenge any easier. So I think kind of like you were saying earlier, April, it's like, don't wait. Yeah, we were just seeing that the rule says it's been pushed officially to July of 2027. Don't wait. The challenge is too big.
Yeah, absolutely. I mean, my recommendation that I give to healthcare leaders, whether, they're my clients or not, is don't wait for the perfect clarity before taking action. Act today. I've seen so many organizations spend, the last year just debating regulations and requirements and implementation details, and they make very little progress at actually reducing the actual risk. The organizations that tend to perform the best, they focus on the fundamentals. They understand their assets. They understand what their risks are. They're prioritizing those wisely. They make informed decisions and they document those decisions, all the things that the proposed rule has in place. While it may continue to evolve, the themes are unlikely to change. They're looking at strong governance, visibility, identity, security, resilience, and evidence-based risk management. If our leaders in healthcare start focusing on those fundamentals today, they'll be in a much, much stronger place when the rule does become final.
Awesome. Thank you. Great conversation. Yeah. We might have to do it again sooner than later just because, it feels so
There's so much more to talk about.
There really is. There's so much to it. And it's like an onion, right? We got to peel back those layers. And, my job is to help clients and my colleagues understand, the prioritization and what's important, and getting those healthcare leaders that we work with on board to ensure that those fundamentals are in place.
We'll move to wrapping it up with our expressions of gratitude. Do you want to kick us off, April?
Sure. Yeah. It's always a tough one to think about and really kind of narrow down. But just lately with, as you two both are probably well aware, I started grad school for my master's degree in April. And, just working full time and doing all the things. I'm just very grateful for the continued support of my fiance and my family as, long days, long nights, lots of studying, lots of work, and just being patient with me as I navigate through these waters.
Do you want to go next, Brad?
Yeah. I'll go ahead and give it to my daughters. My oldest moved out of state to college this week. Yeah, good Lord, this week. And my middle daughter is moving into the dorms in a month. So congrats to both of them. A junior and then a freshman.
Awesome. Yeah, I was awesome and not. I know, like I said, I can't even imagine since mine are not quite teenagers yet. And that's scary enough. I can't even imagine after that when they have to become full adults. But one day, I was similarly expressing like there's always so many things to be grateful for. It's hard to narrow down. So I think for me, it's just continued thanks to our team, to everyone that just continues to push us to be better, and for both our clients and for who we are at FRSecure and for our team here and how we respond to that. I'm constantly challenged, but also encouraged by so many awesome voices and ideas and everything that we have to keep that moving forward and keep that momentum going, and while also taking care of ourselves and pacing ourselves so that we don't burn ourselves out. So it's a challenge, and continue to do that. And I'm grateful for everyone that I work with in doing that. So thank you. Thank you, all of our listeners, for joining us for another episode, and we'll see you again next time.